Attorney General, if I may, Tom said. Okay, fine. We don't do screaming out topics at the library, but thank you.
No, and I hope you would come to the mic and address. No, I would hope you would come to the mic. Wait. Please don't. Please don't force it. Wait. Are you willing to come to the mic, say your name, talk about trans youth who are directly under attack? We have filed several lawsuits to protect health care access for trans youth and adults. We have won many of those. We're in partnership with every provider. So please, say it.
Yeah, I'll talk to you directly.
Yes.
We've had multiple meetings with your office. I'm part of a group that was the first time your office talked to any patients or families that had lost gender-affirming care in the state. And that was not in October when this all started. This was in April, and it was only after pressuring y'all over and over again. What y'all told children who are losing life-saving care, one after another, because these hospitals are not being shown that breaking the law is gonna have any consequences for them in this state. And these clinics are dropping like flies, and your office keeps telling us, wait until it gets worse. There's nothing we can do, even though attorney generals in California and New York are taking the brave and correct stance of prosecuting hospitals for discrimination and for removing life-saving care that is protected in our SHIELD law and is protected under public access.
So your question for the AG is what, please?
The question is, why are you waiting for future federal regulations that your office doesn't know when they're going to happen to prosecute and protect the right of health care for every child in our state?
Thank you.
So first of all, thank you for that. Number one is we have always taken the obligation of ensuring access to those in our trans community very seriously and unapologetically. Many other states, including the Democratic AGs, have not signed on to every lawsuit that we have filed to protect access to funding and resources for this care, including when the Trump administration tried to go after these providers to say we will take away Medicaid or Medicare if you continue to provide gender-affirming care. We have won those lawsuits and we will continue to. We also have to make it clear that right here in Massachusetts, as of even right now and today, every single person that is choosing to get gender-affirming care or any type of health care is still eligible to do so here in Massachusetts. It is still legal, it is still lawful because of our advocacy and the advocacy of you, hospitals, community-based providers, et cetera. The third piece that may be a little different, and this is where the sticky point I think is we could choose to prosecute our own hospitals here. And I don't think we're there yet. And why? Kudos to New York and California. I work closely with AG James and AG Bonta. The last thing I think is helpful right now is if you have organizations, including Children's Hospital, Bay State, Fenway, doing the best they can under a federal regime that is targeting them every single day, including their providers, with attacks, personally, professionally, seeking to take and rip away their resources, not just for gender-affirming care, for every healthcare resource you can think about, working against them, targeting them. I think the federal administration wants us to be doing this. And what is this? Our coalition dividing and one group of folks working against another. And so what I think...
This is not the way it works.
Can I finish? I let you finish.
We're not...
I let you finish.
Go ahead, Attorney General.
And so I do not think we're at a stage now where I should be prosecuting a community-based health organization or children's hospital or others who are doing the best they can. What I do think we can do is tell them what their legal rights and obligations are, which we have. And many of these providers will come back online because of our advocacy. And then the last piece I think is really important is anyone who is not getting the care that you say and I know they deserve and that is legally accessible to them here in Massachusetts, let us know. Because we're not leaving any patient, we are not leaving any patient without care. We're not leaving any patient without care. So then bring those folks to us.
Excuse me.
Then bring those folks to
Let
us.
the Attorney General finish, and then we'll have a conversation. No one can understand what you're.
No one can.
Is there more you want to say?
I will say we're not leaving any child without care. And because I'm not adapting to your strategy of prosecuting our healthcare providers, we may disagree on that. And that's unfortunate. We can't agree to disagree, but let me tell you this. We will not leave any care without care.
Excuse me. If you want to make, we ordinarily don't do this. If you want to make, excuse me, we will turn the mic. The mic is not on. No one can hear a word you're saying. We'll turn it on.
Okay,
This is no point. I'm sorry.
That's
Here's the last
enough.
chance. If one of you wants to make a follow-up statement, we'll turn the mic on. We will gladly hear it. I'm sure the AG will too.
I think what would be helpful is give me a complete list in confidence to my office, and you're in touch with our office because we have a roundtable discussion and we are meeting with you regularly. Give me a list of every single person and every child in this state who is not being able to access gender-affirming care, and we will make sure that they get the care.
Children to these meetings, and your attorney general staff has looked them in the eyes and told them there's nothing they can do because you don't believe in standing up to hospitals and clinics and holding them accountable. You would rather play buddy-buddy with them and protect them against our own civil rights laws. Okay. They are not doing their best. They are stomping their feet on the most vulnerable people, families who have moved across the country to get this care, and you're inviting them to your Pride events instead of saying, these are our laws, and this is what we're going to do.
No, we've made it crystal clear what the laws are, and let me tell you, they have not been happy with that. We've made them crystal clear. So I need from you all to let me know, right now, as of today, every single person in the Commonwealth of Massachusetts that is not receiving the care that they need.
Okay.
And we will make sure that that does happen.
Okay, we're going to take a
Okay.
break. Jamie and Sandra, two of our coworkers, took the names of the three individuals who were just here. We will talk to them, and you wanted to say something else about the issues they raised, Attorney General?
I'm not going to pretend to stand in what their experience is as someone who is in the trans community. I know it's a community that's being targeted, especially kids. And it is life and death for folks in this community. We are fully aware of that. Hence why the lawsuits we filed against the Trump administration to protect access to care for this particular population have been so important. And we have filed many with the support of a children's hospital, a Fenway Health, Bay State, so many. We just don't think the strategy that in New York or California, and not every state has done this, is to prosecute a Fenway Health or a community-based health organization that is attempting to provide care in other ways for policy decisions they have made. We have made it clear to them that there is a legal right to gender-affirming care here in Massachusetts, and there are civil rights obligations. They are now looking to bring these services back online, but the reason they pulled back was out of real fear that they had that their Medicaid and Medicare funding would be taken away. You strip that away, maybe half the people in this library would not have access to health care. And so these are the considerations. And I do think, going back to the fear-mongering piece of the Trump administration, it is designed not just to create fear, but to create divisions in coalitions where you have that happen, where they then continue to put out policies that harm all of us. And so I will never accept or the suggestion that I don't care for young people or trans youth. I care for all of our kids. I've made that crystal clear from the beginning. It's hence why we've led the lawsuits on so many. And then the last piece that I left them with, and my team has too, is if there is anyone in this state who is not receiving gender-affirming care as legally obligated by our state, to let us know, and we will make sure that they get the care they are legally obligated to. And we have done that, obviously, with great confidence and careful how we, of course, share people's information, but we have done that. And we're still awaiting the list of folks who have not been able to receive care, Send me those folks, and we will make sure they get care, and we will continue to fight for them.